you need to be able to react to emerging public health threats. So whether it's Ebola, whether it's SARS that happened a few years ago, whether it's the H1N1 that happened a couple of years ago, or the MERS outbreak that's going on in the Middle East, or the Nipah virus that's going on in Southeast Asia, these are new and emerging threats. You need to have a system that can adapt to these threats to make the public health departments at these different jurisdictions effective. Within the context of communicable diseases, Maven is used to track and manage over 90 some communicable diseases that different public health departments are generally interested in. A case is a person who has been confirmed to have a particular disease. Contacts are the people who have been exposed to that person during the infectious period of that particular infectious disease. And depending on the type of disease, you triage and classify the risk associated with these contacts and make sure those contacts go through appropriate follow-up steps. Contact tracing is very important for infectious disease control like Ebola, especially for an Ebola outbreak. Once you have a confirmed case, you need to trace through all the people that have been in contact with that confirmed case during the infectious time frame of that particular confirmed case. As your data volume grows, so if it's 70 people that you're following or 200 people that you're following, you need to manage those contacts to make sure they're going through appropriate follow-up, monitoring, and potentially quarantine and isolation. Maven software is unique in two very important fronts. First of all, Maven's primary users are epidemiologists and potentially nurses and providers that are working collaboratively on a public health outbreak or a public health situation. The word collaborative is very important because it allows this team of people to work as a team. Number two is that Maven is configurable and configurable in a matter of hours. So depending on the type of public health situation, guidelines and protocols change over time. And these guidelines and protocols need to be implemented in software so that as your distributed team is working on this, they are actually being able to have access to decision support and the latest protocols and guidelines on how to manage and contain a particular public health situation.